Have you ever had a friend who would act extremely clingy at one point and the next moment act aloof? A friend who would feel suicidal one moment and completely fine the next? A friend who is prone to sudden angry outbursts? A friend who would engage in impulsive and self-destructive behavior? A friend who seems to always be suspicious of others in tandem with a fear of abandonment? Chances are that your friend is suffering from borderline personality disorder. Borderline personality disorder, or BPD, is a mood disorder and the commonest personality disorder, with at least 1 in 100 people having BPD. A person with BPD may first experience these symptoms in adolescence, and the intensity of these symptoms can vary from mild to severe. The symptoms of BPD can be grouped into 4 main categories: emotional instability or affective dysregulation, disturbed patterns of thinking and perception or cognitive distortions and perceptual distortions, impulsive behavior, intense and unstable relationships with others. Emotional instability is experiencing a range of intense negative emotions like rage, sorrow, panic, terror, as well as mood swings. Disturbed pattern of thinking and perception is where a person has upsetting thoughts about oneself, hallucinations, and becomes extremely suspicious of people for no reason at all. Impulsive behavior can be of 2 forms: self-harm and engaging in reckless and irresponsible activities, like drugs and alcohol. Finally, since people with BPD fear abandonment, they may experience severe anxiety and become extremely clingy, while at the same time they may feel like their friends are controlling them, thereby acting aloof, resulting in intense and unstable relationships. What causes BPD? There seems to be no single cause for BPD, rather a combination of factors. Genetics, environmental factors, problems with brain development, and neurotransmitters have all been alluded as the culprits for BPD. Neurotransmitters are chemicals found in the brain. They act as messengers transmitting signals between brain cells. Serotonin, which is a neurotransmitter, is instrumental in stabilizing our mood, feelings of well-being and happiness. Altered levels of serotonin has been linked to depression, aggression, and difficulty controlling destructive rages. In other words, emotional instability and impulsive behavior. Therefore, it is hypothesized that people with BPD have problems with neurotransmitter, specifically serotonin. Research has found that those diagnosed with BPD have smaller than expected or unusual levels of activity in 3 specific parts of the brain: the amygdala, which plays a key role in regulating emotions, especially negative emotions; hippocampus, which helps regulate behavior and self-control; and orbitofrontal cortex, which is responsible for planning and decision-making. In addition, these parts of the brain also play a key role in mood regulation. Therefore, problems in the development of the amygdala, hippocampus, and orbitofrontal cortex can result in emotional instability, impulsive behavior, and intense and unstable relationships. Environmental factors such as sexual, physical, or emotional abuse, being exposed to long-term fear or distress as a child, neglect and abandonment has also been shown to contribute to the development of BPD. Psychotherapy such as dialectical behavior therapy, mentalization-based therapy, is the mainstay treatment for BPD. It works by helping the patient to learn skills such as managing emotions, reducing impulsiveness, and being aware of feelings of others. STEPS, or Systems Training for Emotional Predictability and Problem Solving, is a 20 weeks treatment regime that incorporates family members and caregivers to the treatment. At present, pharmacotherapy is not used in treating BPD unless the person has a concurrent mental health condition, like depression, anxiety disorder, or bipolar disorder.